Coronary artery disease, or CAD, is the blockage of the coronary arteries, usually caused by the buildup of cholesterol and fatty deposits on the inner walls of the arteries. These deposits can restrict blood flow to the heart muscle by physically clogging the artery or by causing abnormal function. Without an adequate blood supply, the heart becomes starved of oxygen and could lead to angina or chest pain and even a heart attack. The heart specialists at New York Methodist Hospital's Institute for Cardiology and Cardiac Surgery have the latest diagnostic technology and use the most advanced procedures to treat people living with coronary artery disease. Here's Dr. Soren Brenner discussing how CAD is diagnosed and treated.
Most patients that present to us for evaluation of coronary artery disease present with chest pain. This is the most common cause for evaluation. Patients will be evaluated for the presence of coronary artery disease even when they are asymptomatic if they have high-risk characteristics such as a family history of early coronary artery disease or diabetes, hypertension. The patients are typically evaluated first with a good talk, so to speak. So we really listen to them to see what exactly is it that brings them to the doctor or made their doctor refer them to us. We perform a very careful physical examination, which obviously looks not only at the heart and lungs, but all the other organs. Finally, if indicated, the patients will undergo tests. It starts with an electrocardiogram, blood tests to evaluate levels of cholesterol. And when we perform those tests, we really are trying to identify whether there is any sign or symptoms that indicate the presence of a blockage in one of the arteries of the heart. Doesn't mean that if you have a blockage, you have to do something about it beyond medications. When we do need now to do something, then we have two options: a surgical option, which involves coronary artery bypass surgery, or alternatively, we can open those blockages with balloons and stents. The stent itself is mounted on a balloon. The balloon itself is introduced where the blockage is, and when the balloon is expanded, the stent expands with it. It remains expanded when we collapse the balloon and pull the balloon out. The drug-eluting stents or the drug-coated stents prevent the renarrowing process such that the need for repeat procedures is halved. It is a very safe procedure and the risk is extremely small and certainly commensurate to the benefit that is afforded to the patients.
For many patients, stenting is the best course of action for opening clogged arteries, but for other people living with CAD, surgery is the best option. Here's Dr. Anthony Tortolani, chairman of surgery at New York Methodist, discussing surgical options for CAD.
Patients who have blockage that can be opened with stents usually have one or two arteries blocked off. People who have 3 arteries are blocked off, those people will live longer if they have bypass surgery, especially if they're diabetic, if they're on dialysis, or if they've had previous heart attacks. The patients go directly to our intensive care unit, and they stay there until they get discharged home. So they have the same doctors and nurses with them the whole time. They don't get moved from floor to floor.
For patients with severely reduced heart function, for whom surgery would be too risky, New York Methodist offers a state-of-the-art solution. Our doctors explain.
Through a lot of research, they've developed ventricular assist devices. These are a variety of pumps that we can either put tubes through the skin into the heart and connect it to a pump that sits on the patient's chest. And this pump will take over the work of the heart.
Here at New York Methodist Hospital, we can place short-term devices. Short-term devices allow sometimes the heart muscle to recover, and once the heart muscle to recover, you just remove those devices. Most of these patients move on to getting traditional surgery, either coronary artery bypass surgery or valvular replacement.
These are on our shelves, and these are approved by the FDA. And everybody here has been trained and is experienced in using these devices.
New York Methodist houses state-of-the-art diagnostic and surgical facilities, and the cardiac surgery team at the New York Methodist Cornell Heart Center come from the world-renowned Weill Cornell Medical Center at NewYork-Presbyterian Hospital.
The 3 cardiac surgeons at New York Methodist Hospital all are on the faculty at New York-Presbyterian Hospital, Cornell. The anesthesiologists also work there and work here. If patients request to be operated at Cornell, at NewYork-Presbyterian, we can do that. It's very simple. But it's convenient for their family and friends to visit them here. The referring doctors are here. So I think it's better care if they can get the same quality of surgery at a hospital that's close to home. And that's what New York Methodist Hospital offers patients with heart disease.
The Institute's staff of physicians includes board-certified specialists in all areas of cardiology, interventional cardiology, electrophysiology, and cardiothoracic surgery. Referrals to these specialists or to cardiac programs and services available can be made through a primary care physician or by calling the numbers on your screen.